Wildfire smoke has once again taken hold of Baltimore, but new research from the University of Maryland, Baltimore shows impacts could last long after the skies clear and can come at a steep cost. And joining us now to explain what this means for you is Dr. Zafar Zafari, an associate professor at the University of Maryland, Baltimore School of Pharmacy. Thank you so much for coming in and talking to us about this. So what actually happens to the body when we breathe in that wildfire smoke?
So there's different mechanisms that it basically affects the body. So the study that we published specifically looked at PM2.5. We did not, this is more like an outcomes research, so we looked at the effects of increased levels of PM2.5.
What's that?
So what our team has done at University of Maryland Institute for Health Computing was a series of studies. In the first study led by my colleague, actually we showed an increase in the risk of cardiopulmonary healthcare visits during the identified 6 hotspot days of June 2023, when the levels of particulate matter in PM2.5 with aerodynamic diameters less than 2.5 micrometer increased. So basically the particulate matter that has been linked with a lot of the health issues that we are aware of.
So basically that's inhaling that smoke is affecting people's hearts.
That's right.
That's basically
and lungs,
situation. And the lungs,
exactly.
Yeah. And this isn't just taxing our health, it's also expensive for hospitals. So what can you tell us about that?
Sure. So as part of the second study, actually, we looked at our health, electronic health record data. And so we analyzed the cost estimates of both respiratory and cardiovascular diseases that we observed during those identified 6 hotspot days. And so the estimated cost was $2.4 million during those 6.
$2.4 million? During
those 6 hotspot days.
Those 6 days?
And this is across the 12 hospital systems that we have in the University of Maryland Medical System.
Wow, that's significant, yeah. Are there any long-term risks that we should be concerned about?
Well, we all know that the cardiopulmonary is a risk factor of the future cardiopulmonary, and so once this happens, there's a higher risk of future upcoming cardiopulmonary encounters, hospitalizations, ER visits, and so I think as part of this study, we also look at the historical trends that every 10 years, it seems we have more frequency, and the intensity of these wildfires are on the rise, which is basically a warning for all of us, because we may see more of these events, and then we may see even higher cost and higher rates of utilization for our hospital system.
Deborah and I were talking earlier. This one seems worse than the last one. Is that just this year? Yeah. Does that seem right, or is that maybe our imagination?
It could be. I haven't looked at the numbers yet to see the levels of PM2.5 this year, but it could. Hopefully not, but it could be.
Well, thank you so much, Dr. Zafari, for coming in. We really appreciate it.